So even though there were no words spoken, there was connection. Even though the person with dementia may not be able to express themselves, many times they can still understand. That happens particularly with Alzheimer's dementia and frontotemporal dementia, where language skills are particularly affected, that as the dementia progresses, people will lose their ability to communicate. I would appreciate if you could address what advice you might give to spend time with someone who does not communicate verbally, but lights up when he sees you and hugs you, etc. That is a wonderful question, and it brings up the idea of communication and also connection. Because what is the point of communication? Verbal communication, for example, it's still about connecting with the other person. It's about establishing a common ground of experience. It's about being present with each other in this moment. And speech is a way in which we create this connection. Luckily, there are other ways, there are nonverbal ways in which we can establish this connection. It reminds me of being with my dad as he progressed down the stages of dementia and getting to experience this same concept when his ability to communicate or his level of arousal or awareness was less there. And us sitting with each other and just holding hands and maybe giving him a hand massage or just listening to some of his favorite music, which for him, it was one of the great joys of his life. And I remember being with him in silence, just sitting next to each other, holding hands, and just listening to the music that I know that it stirred his soul. So even though there were no words spoken, there was connection, and there was definitely communication. We were sharing this moment in time. We were sharing the experience of communicating through touch and him knowing that I was there. The acknowledgement that he felt my touch because I could feel him running his hand on mine. And also watching him and perceiving him reacting to the music as the music played on. So the idea that we can connect and communicate with our loved one till the very end is something that is really important to keep in mind. I am reminded of the conversation that we had with the hospice doctor more towards the end of his life, when he was actually in the hospice house. We had moved him perhaps a couple of days prior, and he had significant pain issues and was on morphine and seemed to be sleeping, or at least sedated most of the time. And we asked the hospice doctor, does he hear us? And what she told us was that yes, he does. The studies have shown that even though people may be sedated, that their capacity to still listen and the capacity to know that their loved ones are present is definitely still there. So for us, that was like a liberating thought. It gave us the opportunity to still be there with him. So even though he appeared to be asleep, we were still doing these nonverbal ways of communication. And for example, whenever the hospice nurse would come in to turn him or to change his shirt, they would always take the time to let him know what they were doing. I am going to take your vital signs, or I am going to turn you over to the other side. Kind of respecting and honoring this idea that they still can be and are aware of this, communication. It gave us a sense of comfort that we knew that we could still play his favorite music, which we had on basically, 24/7 for him, and that we could be at the bedside, and that we could talk to him, and that we could hold his hand and caress him, and that there was still connection there. That was not useless, but that was actually a really powerful way of communicating for him and for us. So this is, I think it's such an important question, and it's such an important topic that no matter how far advanced the disease is, connection is still possible, that there is still the ability to connect heart to heart, even though we may not be able to use verbal speech.